Coming up on today's episode of the Health Review.
Acne is a bit of a puzzle, and so what you are trying to do is identify all the different pieces to the puzzle. When we look at sort of the root cause of adult female acne, then we know that hormones are very important, and specifically hormones known as androgens. So patients taking Roaccutane were less likely to be depressed, less likely to self-harm than those taking oral or topical antibiotics. That's because it's more effective. If you're heavy-handed with Botox and don't give enough time for recovery, that you can sort of significantly diminish the size of the muscle bulk. Facial expression is the way we communicate, and if you're unable to communicate, you've lost a massive tool in your toolbox. It's something that we need for everyday life.
Hello, welcome back to the Health Review. Thanks for joining once again, and today I'm very excited to be doing an episode on all things skin health. And we know that over 60% of adults in the UK have reported having a skin condition at some point in their life. And there's lots of new research suggesting that the gut-skin connection could be playing a bigger role than we once thought. We know that adult acne has been on the rise, especially among women in their 30s and 40s. So I'd love to get to the bottom of all of this today, and I'm sitting down with top London consultant dermatologist Dr. Derrick Phillips. We're going to talk all about this: acne, rosacea, aging, lasers, gut health. We're going to cover the lot. Let's get into it. Dr. Derrick, thank you for coming on the Health Review.
Thank you so much for having me, Emily.
It's great to see you here today, and I know you're probably very passionate about dermatology. You're running a really big clinic in London, you're seeing lots of patients. What does it mean to you when someone you've been working with for a while finally, sees progress in their skin? Perhaps they've been struggling with something for a long time. Is it nice to see them feeling, confident again?
Yeah, I mean, ultimately we become doctors and medics to help our patients, and it's the most rewarding part of my job and the greatest privilege to help patients with their skin health journey and to provide treatment that sort of brings about that change and that transformation whereby they feel more like themselves, they feel better and they're more comfortable in their own skin, and their self-confidence is up. So that's definitely the most rewarding part of my job.
I can imagine, and I guess with skin, it's very aesthetic. You can see the change, which unlike other, medical conditions, you can't actually physically see it sometimes. I've struggled on and off with acne throughout my life, have tried all the different things. When I was young, it was about the antibiotics, then pill, which I know a lot of women do. They go on perhaps in their 20s when they have a bit of adult acne going on. Tried a microdose of Roaccutane, which was really helpful. But I can definitely, sympathize with people who feel self-conscious. I know it can affect your mental health. It is really nice when you see progress. In terms of adult acne, I feel like social media has been a really interesting tool for people to not only educate themselves but also share their stories and share their acne journeys. Lots of people are documenting, before and after pictures of perhaps when they've seen a dermatologist or they've made diet changes. How does adult acne differ, would you say, from teenage acne?
Yeah, so acne can affect people at various stages in their lives. So we even see infantile acne, in children. We can see teenage acne, as you mentioned, and adult acne is something that I'm seeing increasingly in my clinics, and affects about 20 to 40% of adults, and a large proportion are women. And the way in which we define sort of adult female acne is sort of acne that occurs in women over 25 and older, and it can be either a first presentation, so someone who's never had acne before and all of a sudden gets acne in their mid-20s, or it can be a continuation of teenage acne. And when we look at sort of the root cause of adult female acne, then we know that sort of hormones are very important, and specifically hormones known as androgens. So these are sort of testosterone and dihydrotestosterone. So they're present in men and in women. And in women, in particularly women with adult female acne, having normal levels can be associated with the acne, and that's because the pores, the oil-producing glands, which are collectively known as the pilosebaceous unit, they are sensitive to normal circulating levels of these androgens, and this can result in a increase in oil production, and oil production is a really important factor for the development of acne. It can also lead to a buildup of keratin or scale inside the pores. That the combination of the excess oil production and the buildup of scale actually leads to sort of a environment being created which is hospitable to a bacterium called C. acnes, and that leads to flourishing of C. acnes and inflammation inside the pores, and this gives rise to all of the features of acne that you see. So everything from your whiteheads, your blackheads, to your what we call papules and pustules, i.e. the red bumps and the yellow pus-filled spots, to nodules, which are the larger red spots, and cysts, of course, which are sort of the deeper fluid-filled lesions. And in adult female acne, a lot of the time, there's a broad range of presentations, and largely speaking, many women will have presentations which are similar to teenage acne in the sense that you can get whiteheads, you can get blackheads, you can get papules, pustules on the forehead, cheeks, chin, so areas which are rich in oil-producing glands. But we do find that sort of particularly in older women that there's a subgroup who tend to have a type which is more nodular cystic and more concentrated in the lower face, affecting the jawline and the U around the mouth. So that is certainly a cohort of women who I often see. The other thing to bear in mind is that sort of in some women with adult acne, they actually do have elevated androgen levels. And this might be due to a range of conditions, the most common one being polycystic ovary syndrome. But there are other endocrine, so hormonal issues which can also manifest with elevated androgens. And in these women, in addition to having acne, they may have additional side effects or symptoms, such as irregular periods. They may experience sort of patterned hair loss, so thinning on the top, and a widening of the frontal parting. They may also find that there's more excessive hair growth in particular areas, and they may also have issues with fertility. So those are sort of the main underlying causes of acne in women. Of course, some less commonly, but sometimes I see it, is that some medications can be associated with acne. So steroids, for instance, which are used for a range of conditions such as asthma to other sort of organ conditions. They can cause an acne-like rash, and some of the newer chemotherapy or cancer medications like the EGFR inhibitors, without getting too technical, they can also cause an acne-like rash as well. And we also know that sort of stress plays a role. So stress is it's not just this metaphysical thing, it correlates with hormones. So we know that with stress there's a rise in cortisol, and that can increase oil production, and that can have an impact on acne. And then also diet as well. So we're learning more and more that the importance of diet. So we know that diets which are rich in refined processed foods and high glycemic index foods, so foods which push your sugar up, can increase the likelihood of developing acne, and dairy can also affect the skin and promote acne. So there's a wide range of causes, whilst teenage acne tends to be more related to the hormonal changes that occur during that specific period.
It's so interesting that there are so many causes, and I think for a lot of people it's really hard to actually work out which one it is for them. I like that you mentioned PCOS. That's something we've discussed on the podcast before. That is one of the big symptoms for a lot of women with PCOS, having acne. But I guess with PCOS, you usually need a few of the sort of symptoms to get a diagnosis. So perhaps if you've got the acne, you might also be having issues with your periods or the hair loss and things like that. So I guess that's like a more of a clear cause. But I think there are a lot of people who are among those other things where they might have an issue with androgen production, they might have high cortisol but don't realize it. And I think this is the issue. It's like, how do you know what is the cause? Is it one cause? Is it, you could have a few of those things going on? And I guess part of your job is to investigate that a bit. So how would you start with someone who's presenting with some adult acne coming to you? Would you sort of go through a list of questions about their lifestyle perhaps?
Yeah, I mean, so the most important thing, as I said, is a holistic approach to try and identify which factors are most relevant to the individual before you, and to work out sort of who is likely to have sort of one of the causes where the androgen levels are raised. And you can get a sense of that by asking questions about the regularity of the cycle, whether there are additional symptoms such as the excess hair growth and the signs such as thinning of the top of the scalp and other features like that. But for the vast majority of women who have the adult female acne, we often don't do blood tests because time and time again sort of studies have shown that their hormone profiles are actually within normal limits, because the factor that's driving it is an increased sensitivity to the androgens rather than overall elevated level. And you can't really test for that at this moment. In terms of sort of once you have the person before you, it's obviously about trying to work out, what type of acne they have, and that's through assessment and also getting a sense of their symptoms. Is it mostly what we call non-inflammatory acne? So are they getting a predominance of whiteheads and blackheads versus sort of the more inflammatory acne, which puts them at risk of scarring? And then based on that sort of information, you can then sort of tailor a plan. So obviously you start off with skincare, but also, wider lifestyle. So diet is important. So I often tell my patients who are prone to acne to consider dairy alternatives because of the impact that can potentially have in the skin. Just to be clear, it's not that dairy is necessarily the one thing that's driving it, but acne is a bit of a puzzle, and so what you were trying to do is identify all the different pieces to the puzzle that are pertinent to that individual. So we would construct a skincare plan based on the products the type of acne or the features that we see in clinic, and that would start off with often there's a retinoid in there, so that would be a retinol or a dapiline or trifarotene or the ones I'm reeling off are sort of the prescription ones, or tretinoin. And the idea of those is just to unblock the pores, reduce inflammation, but they do take a while to kick in. So because a lot of the way in which they work involves a change in the skin through sort of activation of particular genes. So that takes at least 6 to 8 weeks. Patience is a virtue when it comes to anything related to skin. And then sort of, if someone has more inflammatory acne, you might consider sort of possibly antibiotics if appropriate, and they haven't had antibiotics in the past. And then wider conversations about contraception, because there is a role for contraception in some forms of acne. And more importantly, when you're taking the history, the form of contraception is important, because if someone is acne prone and they're taking, for instance, a progesterone only pill, or they're taking a combined oral contraceptive which has a older generation progesterone, then we know that the progesterones can also have a detrimental impact on acne. And so it's about the right form of contraception for you. That's also going to help the skin and not going to be a hindrance to the overall treatment plan.
So it's the long game, as you say, and being patient, waiting to see results.
It's also about sort of managing expectations, and also having a conversation. If you have a wedding coming up in 6 months, then perhaps you would want to reach the optimal treatment more quickly than perhaps if you just want to gradually work through treatments and make sure that you're not don't take anything that you don't have to. For instance, I have a lot of patients who would prefer not to manage their symptoms with oral treatments, and that's not always possible, but we always try. But if you have an event coming up, then it might be that the best treatment for you may be that we start an oral treatment. So all of that needs to be taken into consideration.
I'd like to get your view quickly on Accutane, because I know it was prescribed for more severe cases in the UK via the NHS. I was never given that option because my acne was never that severe. But as an adult, when I've gone to see a dermatologist, I did a microdose, and I actually quite liked this because I didn't get the negative side effects, along with some skin treatments, and it was more of an expensive option because I did some lasers, a bit of microdermabrasion, but honestly, I had crystal clear skin for a number of years. There are reasons why you wouldn't stay on it long term, but what's your view on Accutane as a whole for people who might be curious or a bit afraid of taking it?
So I think that Accutane is it's in my opinion the most effective tool we have against severe forms of acne, and it remains the gold standard of treatment, and it hasn't really been surpassed by other treatments we have. It has its problems, and if you understand how it works, then you can get a sense of it. So we know that sort of the way one of the ways Accutane works is that it shrinks the oil-producing glands, which means that everyone who takes Accutane is going to experience dryness, irrespective of the dose. But at higher doses, you can get more significant dryness, which can make the experience less pleasant. The main concerns that people have about Accutane are regarding mental health concerns, and the vast majority of people who take Accutane they actually see an uplift in their mood because it clears their skin, and it's the acne, it's severe acne that's often playing a large part in their mood and their mental health concerns. So most patients actually see an uplift, but every dermatologist has a story of someone who's taken Roaccutane and has had a negative experience, and it's likely to be an idiosyncratic thing how the person's body reacts to that particular medication rather than something that is common, or something that is predictable. And there's more and more evidence that's come out just to sort of that confirms this. So a few years ago there was a large study published in the British Journal of Dermatology where they looked at tens of thousands of patients who had taken sort of oral antibiotics, topical antibiotics, and Roaccutane. And that particular study showed that the patients taking Roaccutane were less likely to be depressed, less likely to self-harm than those taking oral or topical antibiotics. And that's because it's more effective. The other thing is that sort of in the United States, they have a service called iPledge that everyone taking Roaccutane enrolls to. And the iPledge data supports this as well, that, the majority of people taking Roaccutane actually see an uplift in their mood rather than see a negative change. That being said, there is this idiosyncrasy where, a very small minority of people can experience a change in their mood and can experience mental health symptoms. And that's why Roaccutane should be prescribed by a responsible dermatologist, and that's why patients who are taking Roaccutane need to be monitored extremely closely, and that's why we have lots of things in place to make sure that is done. But coming back to Roaccutane, in terms of sort of clearing the skin, it's the most effective treatment that we have. And one of the issues that we have with the way in which it's thresholded at present is that when someone has really severe nodular cystic acne, often by the time they see a clinician and they've delayed because they tried all the other things, they've developed scarring, and the scarring is much harder to treat once it's established than it is to prevent by active and effective treatment in the first instance. And our knowledge of Roaccutane, even though we've had it for a long time, we're really now sort of getting into our groove in terms of understanding how we can use it. Before, we used to try and get people up to 1 milligram per kilogram, which is quite a high dose based on their body weight. And at higher doses, you tend to experience more of the side effects. We're now noticing that at lower doses, albeit you have to be on it for a bit longer, people have fewer side effects. It's better tolerated. It means that people can essentially continue with their life without having to make too many adjustments, which is great because that's what we want in a treatment. We want a treatment to be effective, but to cause minimal disruption to lifestyle. Of course, when prescribing Roaccutane in women of childbearing potential, that can cause harm to an unborn child, and so effective contraception has to be in place, and so monthly pregnancy tests are usually required unless someone has what is deemed a user independent form of contraception. So something like a coil, an implant, or whereby you don't need to remember to take it, it's already working. And then in those instances we can sort of prescribe it at with greater intervals between appointments. But in terms of my overall a view on Roaccutane, I think it's a great medication. I think it's a great tool, and it's one that I use frequently when it's appropriate. One thing that's probably worth noting and probably not mentioned in many places is that when people have sort of adult acne, and in my clinic, the way I explain it to patients is that you should think of this as more of a chronic condition. And so the treatments that we're doing, they're more management, so they're not curative. Roaccutane effectively acts as a reset.
Yeah.
And so with Roaccutane, you can get, remission for, best case scenario, longer than a decade. Worst case scenario can be, more than a year, but often that gives people that breathing space. And often when, if and when it does come back, it's not as severe as before.
Yeah. It is a bit of a wonder drug. Obviously, caution, care is needed, guidance, everything you just said. But as someone who took it even just on a microdose, so I took 1 to 2 pills a week, and the difference was honestly just never getting a spot in several years, which was amazing. And people would say, "Gosh, your skin is so good," and I'd be like, "Yeah, it's just the Roaccutane plus the lasers, the microdermabrasion, the no drinking, and the no dairy, and the no sugar." Like, I've had to do so many things to have good skin. I have heard, I don't know if this is just like a rumor, that a lot of dermatologists also take small doses of Roaccutane because they know that I heard, I don't know if this, maybe you can myth bust this, but perhaps it's good for aging as well because it's got that retinol type product in it. Is it true that dermatologists take a microdose of Roaccutane?
Well, this dermatologist doesn't take microdose of Roaccutane, but I wouldn't be surprised if there are sort of people, maybe not in the UK, but across the globe who take Roaccutane, small doses intermittently, because it does reduce oil production and it can improve the overall appearance of the skin. And certainly, there are people who use it for anti-aging purposes, although it's not licensed for that, I must say.
I'd love to know your views on where things are going with gut health and the evidence in terms of the link with skin. I'm hearing a lot of nutritionists, functional medicine practitioners who talk about finding the root cause of disease, and they say that your skin is really a mirror of what's happening inside, and it could be a sign that you have something wrong with your gut, dysbiosis, inflammation in your gut. What's the evidence saying from your perspective?
Yeah, I mean, I think that, gut health and the microbiome is a fascinating area, and it's an area of ever-expanding research. And you're right, there is more evidence that's been unearthed, which shows that sort of, dysbiosis may have a impact on inflammation in general, and sort of specific to the skin, some skin conditions. There have been studies which have looked at sort of individuals who have acne and compared their gut microflora to those of normal controls, and found that there are differences in organisms. And there have been some small scale studies whereby probiotics have been used to treat sort of mild to moderate forms of acne with varying levels of success. So I think we're not there yet. I think that it's an area of active research. And of course, as dermatologists and just clinicians in general, it's good to have as many tools as possible, and having a broader understanding of any condition will give us the opportunity for that. So it's an area of ongoing research is what I'd say.
For people who have lost a bit of hope with their skin, they've tried a bit of everything. I know you've led some clinical trials on hormonal acne. What advice would you say to people who have tried a bit of everything and are still struggling with it?
I think what I'd say is that, acne is primarily a medical condition. So I would always suggest that, if you've tried, dietary changes and you've tried skincare, then it's always worthwhile booking an appointment to see either a dermatologist or starting treatment with your GP, because when you see a healthcare professional, they can sort of take a step back and look at the wider picture and try and figure out exactly what the different factors which are contributing to development of your acne. And also with just with time, the number of treatments which are available has expanded dramatically, and so we do have more tools to treat acne. The particular study that you were referencing was looking at a medication called spironolactone, which is a blood pressure medication which dermatologists have been using for a while to treat acne because it blocks the effects of androgens on the pores. And the purpose of that study was to produce a large body of evidence to show that it's effective and it's safe, so that GPs can prescribe it and give GPs the courage to prescribe it, which means that their patients have, in addition to antibiotics, they have other tools, and it could potentially divert patients from antibiotics, and means that those who who don't want to take Roaccutane have an option in the community, because it can be difficult to get to see a dermatologist. But beyond tablets, there are now laser treatments as well, which are very effective at treating acne. So this range from pulse dye lasers, which are lasers which can target the bacteria inside the pores that drive acne. And one of the latest innovations in the past 5 years has been a 1726 nanometer laser. And the purpose, the reason why I mentioned that wavelength is that the research showed that at that wavelength, oil absorbs that wavelength 1.5 times more than water. So it means that when you use that laser, you can preferentially destroy the oil producing glands, which, as I mentioned earlier, the root cause of acne.
And that's potentially a longer term fix, right? If you manage to target that.
Yeah.
Then hopefully it might last for a while.
Well, yeah, so that's the theory. But with time, we'll know, because, for instance, Roaccutane also shrinks the oil-producing glands. But we see that sort of in people with more prolonged, more chronic forms of acne, that it can come back. So I think that it's in the short term, it certainly does improve symptoms, and there'll be many patients who will develop, who will gain many years of clearance following treatment with these lasers. But I think because they haven't been around for long enough, we don't know what the future looks like in terms of whether these patients will require further treatment. But in theory, they may not.
That leads me on to ask you about the skin barrier, because I think there is a lot of talk online about improving your skin barrier to help acne, to stop skin irritation, and it can be a sign that your barrier is damaged. Could lasers do anything to your skin barrier? Like, do we know that it's okay, or could it actually sort of cause some harm there?
Yeah, I mean, so I think so. The skin barrier is obviously the outer layer of the skin, which forms a protective barrier, helps to maintain helps to retain moisture inside the skin and protect the skin from sort of viruses, bacteria, and sort of external aggressors. So having an intact skin barrier is really important, because when the skin barrier is compromised, it increases sensitivity, which means that if you have a pre-existing skin condition, it can affect how you respond to treatments. It can cause your skin to be more irritated, which means that you're less likely to tolerate the treatments. But it can also trigger breakouts if you have a compromised skin barrier. I would always say that sort of any sort of energy-based treatment, I'd always recommend that sort of you've hydrated, moisturized, and really calmed and soothed your skin barrier before going to one of those treatments, because they sort of add heat and energy into the skin, and that can sort of potentially aggravate things if things haven't completely settled. That being said, some of the lasers can be used on inflammatory acne, but there's more controlled local destruction and heating of areas where the acne is.
It's fascinating where things are going, because I guess before lasers weren't really part of the treatment plan, whereas now it can be a very useful tool for people. And for individuals who have something more severe on that case, so psoriasis, eczema, or just really reactive, sensitive skin, a lot of people just have very sensitive skin. Where do you think they should begin if they want to improve the quality of their skin without sort of irritating or causing a flare-up?
Yeah, so I think always caution is key. So err on the side of caution and go for sort of products which are gentle and have been formulated for sensitive skin. So every brand has a sensitive skincare range, are often, fragrance free. They don't have too many preservatives. Their pH is nice and balanced, and try and avoid anything that's way too aggressive, because, if you push the boundary too much, then you might trigger a flare up of your underlying skin condition. And also recognize that, some of these conditions, specifically eczema and psoriasis, it is likely that, you're going to require medical treatment in addition to skincare. And so there's only so much that skincare is going to get you. And also sometimes you need the medical treatment to take it down to a level where the skincare can help.
Yeah, it's difficult, isn't it? Because stress can flare it up. It's not just the products, is it? The diet stuff, as you say, lack of sleep. So I guess there's a bit more to it. But skincare can obviously be, again, a very useful tool, but perhaps part of the puzzle. So not just one thing to focus on.
Exactly. I think we need to zoom out and look at all the factors which contribute, and to everything is part of the puzzle. Diet, skincare, medical treatments, wider lifestyle. So it's all part of the puzzle. Now,
a big skin concern for most people when they get to a certain age is aging, wrinkles, fine lines, sagging. I think for a lot of women especially, they maybe start to see changes in their skin in their, 30s, I guess, and then it kind of progresses. So for people who might be in their 30s or 40s, noticing early signs of aging, fine lines, a bit of volume change, what would you recommend for them to maybe look refreshed and enhance their skin and what they have naturally, but to avoid that kind of overdone look?
Yeah, well, I think that skincare is always a great foundation. So, the first and foremost, the most important thing is obviously sunscreen, and an SPF is going to protect your skin from the harmful effects of the sun, which causes breakdown of collagen and ultimately lead to all the signs of aging, but also vitamin C and retinol, which you probably hear quite a lot, but it's because there's so much evidence for these actives. We know that they can stimulate collagen production, they can help brighten the complexion, and they can really sort of, help the skin to glow and bring back that glow. And peptides as well can also help as well. And then moving on to in-clinic treatments. So we're talking about things which can help to enhance the appearance of the skin rather than change the shape of the face. We want treatments that are going to help to enhance your existing features. And then we go on to sort of, in-clinic treatments. So, we have laser-based treatments which can help to improve skin tone and texture. We also have microneedling and radiofrequency microneedling, which can also sort of help to tighten the skin and reduce the appearance of fine lines or wrinkles. And then we have sort of injectable treatment. So things like, neuromodulators or Botox. And what they can do is through gently weakening the muscles, they can soften the facial expression lines that come and over time become entrenched and form wrinkles. As long as you see a qualified dermatologist, plastic surgeon or esthetician who has experience in using neuromodulators, you shouldn't have the frozen look if that's not what you want. When I personally treat patients with neuromodulators, I want them to retain some level of movement, because facial expression is the way we communicate, and if you're unable to communicate, then it's you've lost a massive tool in your toolbox of it's something that we need for everyday life. In addition to neuromodulators, we have skin boosters and other injectables, so things like Profilo, which is hyaluronic acid at different molecular weights, which can stimulate collagen, elastin, and also we have polynucleotides and other sort of growth factor products which are coming onto the market. So there's a whole range of sort of treatments that we can do to help to enhance beauty, that don't sort of change your appearance, that aren't going to result in you having a frozen face.
Yes, I guess the tweakments they're called now, and I guess some of it is, as you say, like stimulating the collagen that's in your body already, going for that more natural look. I think celebrities are going down that way more, small little brow lifts here and there that are very well done and disguised by plastic surgeons. And as you say, polynucleotides, very popular now. Keep hearing people talk about the, is it the fish sperm?
Yeah,
injectables.
So, exactly. Yes, polynucleotides. So you're right. So they're derived from salmon or trout sperm, and essentially it's the DNA that's injected into particular areas of the skin. So the DNA has a number of properties. The first thing is that it can engage cells in your skin, such as the fibroblasts, which are essentially the factory for producing all of the elements that sort of give the skin its elasticity, it gives it firmness and structure, so it's just collagen, elastin, and also glycosaminoglycans. So it basically stimulates your skin to make more of the things that we lose as we get older and as our skin ages. It's broken down and it's cleared from your system, so it's not like filler, it's not going to hang around. But when you inject it and when it's been broken down, some of the things it's broken down to will draw more water into the skin, so it's actually quite hydrating as well as sort of stimulating collagen production and improving skin texture. It also adds hydration to the skin.
I love that. I love how random that is. Fish sperm. It's just like, who would have known?
Yeah.
Back to Botox quickly. Yes, there was like a study, I think, that came out saying that if you have a frozen face, you can't. Apparently, we use our facial muscles as we're communicating with someone just to understand what they're saying and to feel, the emotion that they're trying to put forward. And sometimes if you can't move your face, you can't really interpret emotions in the same way. And it can lead to mental health issues. It's really fascinating things, I guess, that we didn't know. And that leads me on to ask you about Botox and whether, long term, do we think it's safe? Does the evidence say it's safe? And can it actually weaken some other muscles in your face? So I think there's been a lot of talk, again, online, social media. You never really know what's right and what's wrong. But some people suggesting that if you actually paralyze your muscles, that over time they can kind of age and sag and get weak and perhaps, not the sort of look that you were going for initially.
Yeah, and I think that sort of highlights the importance of making sure that the person who's providing your toxin treatments is a registered practitioner who's also experienced, because essentially when we use Botox, what we're trying to do is to purposely weaken the muscles to reduce the strength of the movement so that you don't get the creasing of the skin, or when we use it in some areas, we're also using it just to shrink the size of the muscles, to, for instance, improve the facial profile where we inject the masseter muscle. But you do need to be aware that the medication does shrink the muscles, and muscles also have a function as well as their beyond their cosmetic function, and there is a risk that if you're heavy-handed with Botox and don't give enough time for recovery, that you can sort of significantly diminish the size of the muscle bulk, and that can have a functional impact as well. For instance, if someone was having too many and too frequent injections into their masseter muscle, then that could potentially have a detrimental effect on their bite and the strength of their ability to chew.
I'd like to get your views on skin cancer, if that's okay. Obviously, it's something that I think is a bit overshadowed online. Like, everyone wants to know about cosmetics. How do I look younger? How do I clear my skin? But I think Australia is doing a good job of raising awareness because skin cancer there is so common. I feel like there's more work that needs to be done in the UK. I've had many conversations with friends about, a lot of us have done, genetic testing over the years, where it comes up with a list, these companies or things that you're more susceptible to. And I think for most people, I've friends that have done this, have had more likely to get skin cancer. Their genetics mean that they're likely to get it at some point in their life. How big of an issue is skin cancer? And what things should we be doing to really protect ourselves from it?
Yeah, so it's a big thing, and I'm glad that sort of there are more conversations happening about it. We are seeing rising levels of the three most common skin cancers, which are basal cell carcinomas, squamous cell carcinomas, and melanoma. So when I first started dermatology, it was uncommon to see anyone with a basal cell carcinoma who's under the age of, I'd say, 37, 38. And now I'm regularly seeing patients in their sort of late 20s with basal cell carcinomas, and the youngest person I've diagnosed with a melanoma is 23. So it really hits home that skin cancers can affect everyone, and it's not necessarily an age limited thing. And the majority of skin cancers are preventable because we know that they're caused by UV exposure to the sun. So UV exposure, it's not just UV exposure from the sun. If you go down our high streets, you still see many indoor tanning beds, which is scandalous considering that there's so much evidence which shows that if you start using sunbeds before the age of 30, then it can increase the risk of developing melanoma by 78%. And melanoma is a potentially life-limiting skin cancer. So it's something that has real-world consequences. And skin cancer is largely preventable just by making sure that you take appropriate precautions. We sort of do away with hobbies such as sunbathing, and make sure that when you're out if you are out in the sun, that you're adequately protected. So with a hat, or a wide brimmed hat or a cap, sunglasses, wearing UV protective clothing, making sure that you're wearing high factor sunscreen, and that you're reapplying it every 2 hours.
Every 2 hours? I feel like no one does that.
Yeah, I mean, so if you're out it's not every 2 hours if you're indoors, for instance.
Yeah. If
you're outside and it's a very hot day, then you do need to be reapplying it every 2 hours to exposed sites. So, if you're wearing a suit and it's just your faces, you don't need to apply to, you don't need to go to change rooms and reapply every 2 hours, just the exposed areas. And if you're indoors, as I said, you don't need to apply every 2 hours. If you are swimming, if you're sweating, then you may need to reapply it more frequently because there's going to be a degree of attrition. You're going to sweat some of it off. You're going to rub it off on towels and things of that nature. So you just need to reapply it. I think one of the issues is that sort of, and it's almost a historical thing, is that people have always seen a tan as something that is desirable. People come back to the office from their holiday and they're showing off their tan. But the way in which you should think about it is that tannin is a defense mechanism by your skin. So your skin is producing more melanin because it's in harm's way. So it's identified that there's a lot of UV radiation and it's producing melanin to protect the DNA of your skin cells and prevent damage. That's going to lead to skin cancer. So a tan is a defense mechanism. So if you have a golden tan and you spent way too much time in the sun, you shouldn't be tanning.
That's a good note, because there is a lot of pressure. I think also beauty standards for women is crazy. And I think for a lot of women, especially in the summer, you feel so much better. I mean, I can say it for myself. Like, I feel so much more confident when I have a tan. It is so weird. It's a bit like having clear skin and versus having a flare up or acne. The difference that you feel like you're glowing. There are products you can use, fake tans, but then again, they're also full of chemicals and we don't necessarily know what that's doing to us. I personally don't feel good when I put on fake tan. I feel like I'm trying to get rid of a toxin from my body. These recent couple of years, I've just been embracing the paleness because I guess, you don't want to be creating long-term damage in any way if possible, even though it does feel great. There's a lot of controversy now about wearing SPF. So with this movement of natural lifestyles, there's a lot of people who are going on plant-based diets and they are using skincare that's got no sort of harmful ingredients. And with that, they're trying to avoid certain SPFs. And there are people online saying, exposure to the sun is not dangerous. You can get sun safely, but you just don't want to like bake in it all day long. What would you say to comments like that?
I think there's, unrefutable scientific evidence which shows the direct link between UV exposure and skin cancer in fair-skinned individuals. So we know exactly how the skin is damaged. We know sort of how the mutations develop. We know how the skin cancer develops, and it's a very sort of linear, correlation. So the sun UV exposure does cause skin cancer, and sunscreens are an effective tool to protect against that. And skin cancer can potentially be life-limiting. So it's an easy way to protect yourself and your family by applying sunscreen. And there's so many sunscreens in the market that, if you do have concerns about particular ingredients, then you can pick one that doesn't have them.
There are good apps now. I use the one Yuka, where you can scan products and look for alternatives. So I've been doing this on most of my skincare, and it's quite helpful. You can see which ones have the most harmful ingredients. But most of them have harmful ingredients, which is what's quite scary.
I mean, I think one thing to bear in mind is that concentrations are important. So, there is a very complex regulatory framework which serves to protect us, and it sort of tightly regulates what can go into products. So everything that goes into a product has to sort of meet EU and, FDA, approval. So the majority of the products that are on the shelves, I mean, the products on the shelves, they have to be safe to be on the shelves.
That's a really good
and
point.
they do undergo sort of, post hoc, testing and things of that nature.
Yeah, that's a great point. Dr. Derrick Phillips, thank you so much for coming on the Health Review. For people who've enjoyed this conversation, might have some concerns, perhaps they want to check their skin for anything like moles and things like that, or acne concerns, potential laser treatments, and they'd like to come and see you, where can they find you?
So I'm based at One Welbeck and also Skin 55 on Harley Street, but all of my details are on my Instagram, which is at Dr. Derrick Phillips, or my website, which is drderrickphillips.com.
Dr. Derrick Phillips, thank you so much for coming on the Health Review.
Thank you so much for having me.